She's had liposuction in the past. She's not had a BBL, but she had liposuction in the past. And I just wanted to point out to you the shape if you don't do the key area. So here she's had lipo, and you can see how I've drawn a line here, and there's really where her underwear fits. And most people call this, you know, her natural waist where her pants would sit. And so all the lipo was done from this line all the way up, but none of the lipo was done in the key area. And it took me a while to really kind of become more comfortable with liposuction through the key area, because you really feel that you're liposucking the butt. And we're always taught in residency, do not perform liposuction in the gluteal area, right in the butt, because you get a worse result. And so it took me quite a few years, and I kind of became more and more brave, and took a little bit more, and I liked the results a lot better, and that's really why I developed liposuction through the key area. But this is a really good example. So she had lipo, but no lipo through the key area. I don't know if you can see this. This is what I look at. So I'm always looking at this line, right? This is the Ogee line. And you try and determine, well, where is the start and stop of the key area? The start's pretty easy. It starts right here. You can see it starting to come down. But there is a question as to how far it comes down. Well, the part that I look at that just stands out to me is right there, because that's where it's coming out, and then it starts to get flat here. So I know that if I lipo that and take this out, which is a key area, which actually extends around into her front. That's a different story. We'll talk about that in a minute. I know that if I lipo that, then that's going to be gone, and that's going to start to round the butt. So then when I put the fat in here, that's going to complete that convex part of the Ogee. And the key area is really the transition between the convex part of the Ogee and the concave part of the Ogee. So now you actually see that her key area extends very far to the front. So usually the key area will kind of fade a little bit, but when it extends to the front, then I lipo in the front as well. And so I always say to patients, go to the surgeon that you see their work and you like their style, because that's going to be the best fit for you. Obviously, the surgeon that did this surgery didn't want to lipo the key area. And not everyone does want to lipo the key area. Not everyone does lipo the key area, and not all patients lipo it. Once in a while, I have somebody that comes in and says, I don't want you to lipo through the key area. So I don't, but I really would prefer if they had surgery with somebody who didn't lipo the key area, because that's what I do every day, is I lipo the key area. So this is what I like, and this is what I over the years have developed and what I think looks the best. But that's just my opinion. And if you share that opinion, then good, I'm a good surgeon for you. If you don't share that opinion, that's fine. You don't have to leave a bad comment, although you can, because honestly, it sometimes makes me laugh. But just find somebody who you share the same look with, the same style. I really think that's super important when selecting a surgeon.